I am Dr. Nandita Mohan, and now we have an esteemed panel of doctors who have joined us today. We have Dr. Brajesh Kumar Mishra, who's the consultant in cardiology at Manipal Hospital, Gurgaon. Dr. Mishra is a well-known cardiologist, and he has 24 years of experience in cardiology and also has worked as an expert in different cities in India. He has contributed to handling numerous complex medical cases in several hospitals and also is known for his attention to accurate diagnosis and also for treating patients empathetically. His special interests are procedures like radial procedures, ICD and CRTD pacemakers, interventional cardiology, cardiac electrophysiology, etc., to name a few. And he's also an active member of the Indian Medical Association and the Indian Heart Rhythm Society. We also have Dr. Ujjawal Kumar, who's the consultant in cardiology and highly skilled cardiology consultant, and who's known for his TAVI and TAVR surgeon in Faridabad and Delhi NCR. His specialties lay in transcatheter aortic valve implantation, replacement, coronary angiography, coronary angioplasty through radial and femoral routes, intravascular imaging, physiological assessment by FFR, IFR pacemakers and ICD, Holter monitoring, renal angioplasty, to name a few. In addition to being an expert in this field, he has a DM in cardiology as well as postdoctoral fellowship and an MD in internal medicine. He is also highly involved in research and has published multiple journals and has researched in multiple numerous types. And thirdly, we have Dr. Anupama Hegde, who's also a consultant in DNB cardiology. She has more than 14 years of experience with 9 years of teaching experience. She is trained in advanced echocardiography and has performed more than 10,000 diagnostic as well as therapeutic cardiac procedures. She is capable of performing primary as well as complex angioplasties, and her special interest lies in management of cardiac disease in women and has started first of its kind state-of-art healthy heart clinic for women. Her other fields of interest include management of pulmonary hypertension and cardiac problems in patients who have recovered from COVID-19. She has also worked as a diabetologist for 6 months before starting her career as cardiologist. She has vast experience in preventive as well as clinical cardiology, has worked as a co-investigator as well as a principal investigator in various phase 2 and phase 3 clinical trials. She is involved in planning capacity building program at community level for recognition, referral and rehabilitation of patients with cardiac problems. So I welcome all of you on board here with us today, and welcome to Medical Dialogues, and thank you for joining us today at Medical Dialogues.
Thank you.
Thank you.
Thank you so much for the kind introduction.
Great. So now we're gathered here today on World Heart Day. So there are several common myths which are surrounding cholesterol, if I may talk about that in a little bit of detail with you all today, that can actually lead to confusion about its role in health and how actually it has to be managed. So today we are here to discuss some of these myths, and there are several myths surrounding it. So we definitely would want to have a mythbuster session with the three of you.
Right.
So firstly, Dr. Brajesh, if I may ask you, there is a myth stating that all cholesterol is bad, meaning cholesterol is harmful, we all know about it, and it should be entirely eliminated. Is that a myth or is it a fact? What is your take on it?
This is a myth, because we know that cholesterol is required in our daily life. We know that cholesterol is essential ingredient of so many things in our body. Like all cell membrane is composed of cholesterol. It is required in synthesis of myelin for the function of brain. This is required for synthesis of hormones, vitamin D, as well as bile synthesis for the proper digestion. Therefore, all cholesterols are not bad. There are certain cholesterol which are considered as bad or good. These broadly, the people commonly know this as a HDL cholesterol, which is considered as good cholesterol, and non-HDL cholesterol, which is known as LDL cholesterol, triglyceride, LDL, ApoB. There are so many other cholesterols which are considered as bad for heart, and it is well proven that if there is high amount of those bad cholesterol, leads to poor vascular health, leading to myocardial infarction, stroke, or peripheral vascular disease.
Great. Now to Dr. Anupama, if I may ask, eating cholesterol-rich foods raises blood cholesterol. What is your take on it?
It is not a total truth, it's partial myth. In all people, dietary cholesterol does not increase their harmful cholesterol. But especially people already have a high risk of dyslipidemia or high bad cholesterols, they are supposed to be careful with diet. But if you are very particular about your diet, then you can have egg a day. If you want, use white, avoid the yellow, and avoid trans fats and saturated fats. Eating nuts, food rich in fiber, and vegetable use of vegetable oils will prevent your increase in bad cholesterol.
Great, great. Now, coming to Dr. Ujjwal, I have a question for you which states that only overweight people have high cholesterol. That is, if you are not overweight, you don't need to worry about cholesterol. Is it true?
No, it's not true. Overweight people will definitely have higher level of cholesterol levels, but even patients who are not overweight, because the cholesterol levels is just not determined by the weight, it is determined by the body's metabolic factors, many things, how our body converts a lot of sugars, whatever we eat, and it is converted into fats. So it basically depends upon your genetics, how your body metabolism is there, and that determines your cholesterol levels. So definitely overweight people will have a higher risk of having higher cholesterol levels, but it doesn't mean that if you are not overweight, you will not have high cholesterol.
Okay, great, great. Now coming to Dr. Brajesh again, young people don't need to worry about cholesterol. That is, cholesterol issues. Is it true that it only affects older adults?
This is not the truth. Obviously, we know that dyslipidemia or abnormal cholesterol is basically a disease of your lifestyle. And it is well proven that those in the initial experiments which were done in early days on animals, those animals were fed on the rich cholesterol diet, and what was observed was a appearance of the fatty streak on the intima of the aorta. That was the initial observation, and how we linked the abnormal cholesterol to the deposition of fat. That was well demonstrated by this experiment. And if we see that initially the progression of plaque happens as a minute deposition of abnormal cholesterol, which is modified by the macrophages and which progresses further. Therefore, it's not an acute manifestation. It's a chronic progression of disease, and which begins too early and manifests late. Therefore, if you have a history of early disease, early coronary artery disease, or a family history of disease, or a family history of dyslipidemia, you need to understand that if your lifestyle is very good from the beginning of the life, since the early childhood days, that modifies the risk level to the cardiovascular disease. Therefore, to begin with, it should started in the early adulthood, like after 20-30 years, you have to consider about this analysis, and obviously you have to acquire a good lifestyle to prevent progression of this problem.
Great, great. Now coming, Dr. Ujjwal, again, if I may ask, cholesterol medication can replace healthy lifestyle choices. That is, we know statins are the primary medications that are usually prescribed for cholesterol. So taking statins or any other cholesterol lowering drug means that you don't need to worry about diet and exercise?
No, it's a complete myth. Basically, a healthy lifestyle is the first thing what we need to have, as sir told previously. That has to be started at a pretty young age, because those are kind of habits once you develop early in your life, that continues as your life age progresses. As these cardiovascular diseases, any cerebrovascular diseases, they have a higher risk once you're under elderly age. So if you have a good lifestyle, healthy lifestyle, if you exercise a lot, if you walk a lot, around 45 minutes of brisk walking, have a good healthy diet, then your risk factors will reduce, and on top of that, the medicines will just help you lower the risk. So there is no substitution of a healthy lifestyle, a healthy diet. The medications are definitely not a substitute. It helps on, it adds on to it.
So basically, medicines are just an adjunct. You basically
Yes.
have to focus on your healthy lifestyle. That is the core
Yes.
treatment if you really want to lower your cholesterol levels.
There is nothing to really substitute a healthy lifestyle and a healthy diet.
Very true, very true. Now, Dr. Anupama, women don't need to worry about cholesterol until menopause. Cholesterol, does it become a concern for women only after menopause? Is it true?
It's a myth. See, the risk of high cholesterol or dyslipidemia can occur at any age. Yes, after menopause, because of the hormonal changes, the risk of developing high cholesterol levels are high. But even from childhood, depend on your family history, your genetic makeup, your diet and exercise, you have the risk of developing bad cholesterol. Nowadays, the kids are fond of junk food. They are more on the sedentary lifestyle. Childhood obesity is on the high rise, even in female kids. So this contributes to rise of higher risk of dyslipidemia right from the younger ages. So you have to take care right from childhood.
Very true, ma'am. Right from childhood, as even Dr. Ujjwal mentioned, lifestyle changes have to be made and the correct choices have to be incorporated right from the very beginning. Only then that will go a long way and that will help you lead a longer life. Secondly, Dr. Ujjwal, if I may ask you again, you can feel when your cholesterol is high. Does high cholesterol show any noticeable symptoms in your body?
Usually, your cholesterol levels have to be checked by a blood sample. There are certain things which help us as clinicians to say the patient might be having a high, like there are some spots over the eyes, there will be some creases over the earlobes. They are just little, and some there'll be some fat deposits over the elbows. So these things definitely help guide us that the patient might be having high cholesterol levels. But as such, the patient might not be having any symptoms. The best thing is to get preventive health checkups done, get your cholesterol levels checked annually, and if you're a diabetic, then definitely every 6 monthly or a 3 monthly checkup of the cholesterol levels is needed along with your sugar levels. So it is we cannot say that the high cholesterol levels will produce some symptoms. So once it starts producing symptoms, it might be too late as well. You might be having some full-blown disease by that time.
Okay, great. Now coming to Dr. Brajesh, cholesterol is only related to heart health. Is there anything which states that it only affects the heart?
This is not truth, ma'am. What I feel that we always talk about lipid in association with the cardiovascular health. It's not only cardiac health. We talk about cardiovascular, which includes a heart as well as brain as well as vascular. That it means that if there is deposition of plaque or cholesterol in the heart, which leads to angina or blockage in the coronary circulation or the heart circulation leading to heart attack, if the similar thing happens in the brain, this leads to a stroke. Similar thing happens in the peripheral vascular arteries, this leads to ischemia, limb ischemia. Therefore, it's all vascular health which is interlinked, and lipid is a risk factor of cardiovascular health, not only a cardiac health.
Okay, great. Lastly, if I may ask the all the three of you, switching to low-fat food automatically lowers cholesterol. Now we discussed about healthy lifestyle, we discussed about exercise that have to be incorporated on a daily basis. So if one just switches to a low-fat food, eating low-fat food, does it guarantee that your cholesterols will become low? Does it guarantee a lower cholesterol?
No.
Dr. Anupama, if I may ask you first.
Yeah, it doesn't, because most of the low fat food are rich in carbohydrates. So high carbohydrates in turn get converted into fats in your body. So your cholesterol, especially LDL levels, goes up. So, and also at the same time, you're going to lose the essential fatty acids if you take only low fat diet. So your diet has to be balanced. You have to have the essential fatty acids. You should have high protein and moderate level of carbohydrate. That only then you can have a good healthy life and your cholesterol levels can be maintained in the normal range.
Great. Dr. Brajesh, if you want to add anything on to what Dr. Anupama just said.
Diet is just one part of the holistic care of cardiac health or a vascular health. Only thing which is important is that you have to integrate all the things. The diet, the diet should be, we know the concept of Mediterranean diet in management of cardiovascular health. It means that your diet must be rich in fibers, fruits and nuts, should have a good amount of protein and low in the carbohydrate. And with the holistic care is essential ingredient, which includes the other things also, like exercise, like meditation and yoga. Everything is essential for management of cardiovascular health, and diet is just one part of management.
Dr. Ujjwal, anything that you would want to add on?
Yes, as ma'am and sir as well told, it is just not the fatty foods what we are concentrating upon. All these packaged food, sweetened beverages, they are very high in sugar levels, they are very high in carbohydrate levels. So they will in turn get converted into fats. So it doesn't mean that if you are consuming less amount of fried foods, your cholesterol levels would be normal. So the main important takeaway would be you should be exercising more. You should be burning more amount of calories than what you eat. So your amount and proper healthy diets, which includes, as ma'am told, a good amount of fibers is required and a moderate amount of carbohydrates and a good amount of protein intake. So a balanced diet, a healthy lifestyle with regular exercises and a good diet, I think so that should be good enough to lead a healthy lifestyle.
Great. Any last message that you would want to give out to our viewers? Dr. Anupama, if you want to say out anything.
First of all, exercise, have a healthy high lifestyle, encourage more stress busters, and good diet. That can give you a healthy heart and a healthy life.
Great. Dr. Brajesh, anything that you would want to say?
Nowadays, what we see that in society there is a lot of stress. The smoking is coming up in a big way. You can see frequently even all part of the society they are smoking. The female, male. Now it's coming up, and this adding on to the cardiovascular events. Therefore, you have to stop smoking. You have to exercise regularly. You have to keep your diet well within control, and these holistic care will prevent any cardiovascular health. A holistic care is required for better cardiac.
Great. So thank you so much for joining us today on World Heart Day and giving us all your valuable keynote messages. And it is lovely to be interacting with all of you, Dr. Anupama, Dr. Brajesh, and Dr. Ujjawal. Thank you once again for joining us at Medical Dialogues.
Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.